battle for comprehensive health care reform is nothing new in Washington. Throughout American history, political leaders have courageously tried and failed to expand health care coverage to all Americans. In 1948, Harry Truman campaigned on a platform of expanding the New Deal to include national health insurance for everyone.
I've repeatedly asked the Congress to pass a health program. The nation suffers from lack of medical care. That situation can be remedied anytime the Congress wants to act upon it.
While Harry Truman won the presidential election in a dramatic upset, fear of socialism and strong opposition by Southern Democrats put an end to all of Truman's health reform initiatives. "17 years later, President Lyndon Johnson would again take up the cause of a national health plan as part of his Great Society. In 1965, with former President Truman at his side, Johnson signed legislation that would incorporate Medicare and Medicaid into the Social Security Act. It was characterized as the most significant piece of health reform legislation of the century.
No longer will older Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings that they have so carefully put away over a lifetime so that they might enjoy dignity in their later years.
1973 marked another step when President Richard Nixon helped pass the Health Maintenance Organization Act, requiring employers with traditional health plans to also provide the option of choosing an HMO for their employees. But 1 year later, President Nixon pushed unsuccessfully for a comprehensive health insurance plan, or CHIP, proposed by Senator Packwood and Representatives Mills and Schneebeli. Under CHIP, every employer would be required to offer health insurance to all full-time employees. Nixon argued CHIP was a more cost-efficient plan than a more comprehensive proposal being promoted by Senator Ted Kennedy.
Under this plan, that we would not have to have any new federal taxes. The additional costs could be paid for out of revenue that would be already available. More importantly, our entire health care system would not be placed under the heavy hand of the federal government. And as I said in my State of the Union message, most important, the great majority of doctors in this nation would be working for their patients rather than be working for the government. And that is the key element of this plan.
Any attempts to reach a compromise between the Nixon and Kennedy health reform plans were derailed by the Watergate hearings and President Nixon's resignation. In 1988, President Ronald Reagan's administration passed the Medicare Catastrophic Coverage Act, expanding Medicare coverage to include prescription drugs and a cap on beneficiaries' out-of-pocket expenses. A groundswell of negative reaction led to its repeal 1 year later. In 1993, President Bill Clinton introduced the Health Security Act, calling for universal coverage, employer and individual mandates, and competition between private insurers.
We could cover every American with the money we're spending right now if we just had the courage to demand insurance reform / healthcare bureaucracies, if we followed the lead of other nations in controlling the unnecessary spread of technology, stopping drug prices from going up at 3 times the rate of inflation, and forcing the people who send the bills to sit down with the people who pay the bills and planning out what we're going to spend on health care from year to year.
Senate Republican leaders countered with their own plan. Minority Leader Robert Dole co-sponsored a bill with Senator John Chafee that sought to achieve universal coverage through a mandate on individuals to buy insurance.
We want to increase the number of Americans who have health insurance with our goal of eventually covering everyone. Everybody would agree with that, I think. Very few not. And secondly, our objective is to get costs lower for individuals, for companies, for state governments, and for the federal government. Cost containment.
Again, a compromise leading to comprehensive health care reform would fail. In 2003, during the Bush administration, the Medicare Drug Improvement and Modernization Act passed, creating a voluntary subsidized prescription drug benefit under Medicare. The Medicare Part D drug benefit went into effect in January 2006. In 2009, newly elected President Barack Obama established the Office of Health Reform to coordinate administrative efforts on national health reform. That year, the Children's Health Insurance Program, or CHIP, was reauthorized, providing states with additional funding, new tools, and fiscal incentives to help reach the estimated 4.1 million children through Medicaid and CHIP who otherwise would have been uninsured by 2013. On March 23, 2010, some 50 years after the passage of Medicaid, comprehensive health care reform reached a significant milestone. President Obama signed into law the Patient Protection and Affordable Care Act.
Teddy Roosevelt called for it, Harry Truman called for it, Richard Nixon called for it, Jimmy Carter called for it, Bill Clinton called for it. But while significant individual reforms have been made, efforts at comprehensive reform that covers everyone and brings down costs have largely failed. When faced with crisis, we did not shrink from our challenge, we overcame it.